The number one cause of thyroid cancer is thyroid nodules, goiters, and cysts. But the number one cause of those thyroid goiters, nodules, and cysts is
how many practitioners out there really and truly understand what to be looking for when it comes to antibody testing.
well, first of all, there's one group, which is the people coming with low thyroid, who already knows that they're taking medication and they've never had their antibodies tested. That's one group. Another group don't even know they have low thyroid, have every symptom of low thyroid, have never had even functional full comprehensive panel tested, didn't even know they were low thyroid. So of course they didn't have their antibodies tested. Is it cool? Is it okay not to have your antibodies tested?
Obviously, I mean, we've got to get these things tested. I think that the important thing is with even when we're considering the autoimmune attack with the thyroid, and I think I can't remember who it was, but had the nodules that she mentioned, as part of her symptoms. I mean, that can be dangerous. I mean, it can actually be life-threatening to not get this tested. And I think it's poo-pooed a lot. And we're like, oh, they've got hashies or this or that or the other thing. It's a big freaking deal. Like, it can be life-threatening. And when we don't have the due diligence to help our patients sort these things out, we're doing them an injustice. I mean, it's frustrating.
So many people are coming in without this information, and it is so vital that they have it in their hands so that they can take the proper steps to actually reduce the autoimmune attack on their body. And if they don't have this information, they're not doing anything. And then, like you said before, the target of autoimmunity can switch to another area of the body.
Hi, I'm Maggie, UMD, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power-packed 30-minute training that goes over what are the 5 pillars of Transform. Go ahead, click the link, and I'll see you in that training. I was talking, not this Julie, but another Julie earlier today, but funny the name, nodules. Let's focus a second on nodules here. And autoimmunity. The only reason that someone would have thyroid nodules, goiters, and cysts is because the thyroid is trying to respond to the autoimmune attack, your immune system trying to attack your thyroid. Nodules, the only reason, and cancer, thyroid cancer, the only reason you would have it is because you have an underlying autoimmune attack against it. So when I was talking to Julia earlier today, she said, I was told my thyroid numbers were fine. When I had a thyroid ultrasound, I was told I had a nodule and that we would watch and wait and see and repeat it in 3 years. Okay. Is that a do this or is it a don't do that? So if you were told, how many of you guys have been told you have a thyroid nodules, goiter, and cysts? We're going to watch and wait. Okay. You've been told to do this. We're going to tell you, not that. What should you do instead? What do you guys think? What should someone in that situation do instead?
Anybody who has been through the program or has an idea, type it in chat. What do you think you should be asking for? And I will tell you, I had to practically beg for this. And I've had to do it on more than one occasion because for some reason, doctors are very hesitant to offer this. So what is it that Dr. Maggie is alluding to that needs to be done to take a look at these nodules, goiters, and cysts?
Write this down as a note, everybody. Pay attention. This is going to be a lifesaver. If it's not you, it's somebody else. Okay.
And I've actually seen people go through the program who have said, oh my gosh, based on your recommendation for this, it may have just saved my life. So what is this?
I mean, okay. The number one cause of thyroid cancer is thyroid nodules, goiters, and cysts. But the number one cause of those nodules, thyroid, goiters, nodules, and cysts is an autoimmune attack against your thyroid, right? So for everybody who knows that they have an autoimmune attack against their thyroid, right? If they know that as a fact, 100%, have you gotten a thyroid ultrasound? Ultrasound uses sound waves. There's no radiation involved. It's run over your thyroid, and we can see clearer visual identification of whether there's going to be swelling around your thyroid, shrinkage, scarring in a certain area. Is there a nodule, like a little knobbing over here? Is there a circle filled with fluid that's called a cyst? Is it overall swollen instead of a nice clean little butterfly here? That would be swelling of the thyroid, which would be more what we call a goiter. So none of those are normal findings. None of those would be seen in someone who doesn't have an underlying autoimmune attack against their thyroid, right? So what this means is thyroid cancer is 100% preventable.
Say it again.
Thyroid cancer is 100% preventable.
What I find fascinating is if you went to your doctor and they found a lump on your breast or under your armpit, would they say, come back in 3 years and we'll take another look?
Never.
I mean,
Good point.
so why do we do that with the thyroid?
It's such a good question.
It's a great point.
Right? So the most important thing to do if you have autoimmune related low thyroid is to get a thyroid ultrasound. This is really critical. And if you have a doctor that's fighting you on it, run, switch to a different provider. Because why? Because number one, they don't understand that most low thyroid is actually autoimmune, number one. Number two, they don't even realize autoimmune low thyroid and autoimmune thyroid with Goiters, nodules, and cysts is the number one cause of thyroid cancer, which is a preventable cancer. You know what? I'm going to ask for a raise of hands right here, okay? And if you have all of them, like write all of them. Do you have a thyroid nodule? Do you have goiter there? Do you have a cyst there? Do you have it swollen? Have you been told there's scar tissue there? Does it feel abnormal? And I'm going to show you guys something. You know what? Put your hands over your thyroid like this. And I visually see it, but like feel your thyroid right here. It should feel kind of soft, fluffy, uniform on both sides. You shouldn't feel like there's like a frozen pea inside, right? Or none of it should hurt or feel full or uncomfortable. How many of you, even as you sit right here, feel like there's some fullness here? Or look at yourself in the mirror right now. Maybe you should like pull out your phone and take a look right now. Does it look kind of full here, right? Does it look swollen? And some people literally, this looks super swollen and they're being told it's normal. But sometimes it's just a sensation of fullness. If any of this is you, type it in chat right now, because there are literally millions of you out there and this is missed. How many of you have thyroid symptoms or even have low thyroid and have never had a doctor even examine your thyroid the way I just talked about it? How many have never had the thyroid even touched, right? So put it in chat. I just wanted to give you guys that tool of how I check my own thyroid, whether that's by palpation, touching, or even visually when I look at someone. Hey, if you really enjoyed what you're watching and you want to learn more about this topic, make sure you check out, if you're on YouTube, some of the suggestions for what to watch next right here. And if you're watching on any other format, feel free to comment in the comment section. Our team and I will get those resources to you. And if you haven't clicked subscribe yet on YouTube, make sure to click subscribe and ring the bell so you get notified every time we are live. Thanks, everyone.